Hello and a very warm welcome to everyone joining us for today's Select Science webinar entitled How a Private Testing Lab Realigned its Services to Meet the Needs of the Global Pandemic. My name is Dr. Carrie Haslam and I will be moderating today's session. I'm delighted to introduce today's expert speakers, Nick Bills, Healthcare and Infectious Disease Director, and Dr. Tom Burr at Source Bioscience, as well as Enrique Wang, Director UN and Africa, George Lee, Director Americas, and Peter Paddison, Director of Business Operations at Haier Biomedical. In the webinar today, our experts will explore exactly how Source Bioscience work with Haier Biomedical to deliver the resulting state-of-the-art COVID-19 testing facilities in the UK. Plus, you'll learn about Haier Biomedical's product portfolio and how its global manufacturing and R&D has changed to meet the demands of clients around the world setting up COVID-19 testing facilities. I'd now like to hand over to Haier Biomedical.
Hello and welcome to Haier Biomedical Qingdao, China. Thank you for joining us today. I'm Guangsheng Wang. I oversee the international department at Haier Biomedical. We hope you can benefit from today's webinar from Qingdao and Haier Biomedical to the world.
Thank you, Mr. Wong, for that warm welcome, and a warm welcome from me as well. I'm Peter Peterson, Director of International Business Operations and Marketing Departments here at Haier Biomedical. You've just seen a quick snapshot video of our customers and end users across the 130 countries that we cover around the world. And today, due to time limitations, I'm going to give you a quick walkthrough of our exhibition centre. Due to those limitations, we would like you to maybe join our website and at www.haier-medical.com, and you'll be able to actually do a virtual tour through the system. So come for a little walk with me. I'm going to show you firstly our blood solution. Our IoT blood solution is the leader in the world. And some of our products here at the exhibition centre, which we're very proud of, is our vehicle mounted blood refrigerator, our transport coolers, and our internet plasma storage box, and our IoT blood refrigerator, as this showing some of our storage blood solutions. What's most important is our automated blood storage system, which provides a safeguard for blood from vein to vein. What you also can see there is our blood refrigerator and our clinical use scenario system as well. So that's just a quick snapshot of our blood solutions. And as I said, we have this virtual tour on our website. But later today, from behind me, you're going to hear from Enrique Wang, who's going to talk a little bit more about our vaccine program and our cold chain, as well as you'll hear from George Lee, our Director of Americas, who will talk about the greater Haier group and how Haier Biomedical fits within that group. So without further ado, I want to hand over now to the UK, to our moderator, Dr. Haslam, and she's going to moderate the talk today with Source Bioscience. And Source Bioscience are going to talk about why they chose Haier Biomedical over our competitors and why you should choose Haier Biomedical over anybody else. So thank you for your time. You'll see me a bit later during question time. So now over to the UK. Thank you.
Thank you, Peter, for that fantastic overview. I am now delighted to be joined with Nick Bills, Healthcare and Infectious Disease Director, and Dr. Tom Burr, Chief Scientific Officer, to tell us more about their state-of-the-art COVID-19 testing facility. I'd now like to begin with you, Nick. Please, can you tell us more about your testing facility in Nottingham?
Hi, yeah, certainly. So we have a purpose-built COVID testing facility, which has a capacity of around 25,000 samples a day. This is supported by approximately 175 staff who have been trained and deemed competent using state-of-the-art automated extraction techniques, sequencing, and PCR analyzers.
Fantastic, thank you for that overview. And what have you learned from setting up and running a facility such as this within very short timeframes?
From a learning experience, I think we were benefited by the fact that we were running an infectious disease testing facility already. So fundamentally, we switched our focus of attention at the time of the outbreak of the pandemic, which enabled us to mobilize relatively quickly, and obviously became one of the first private laboratories to support the DHSC. I think one of the main learnings was around the procurement of reagents, consumables, and equipment, and found that a solid procurement chain is required to allow you to flex and change in a short time frame.
Perfect. Thank you for those answers, Nick. It's great to hear more about your testing facility, especially being one of the first labs to offer support to the DHSC. Now, moving on with Dr. Tom Burr, can you tell us what is needed to become an accredited testing provider?
Yeah, of course. We've been offering accredited healthcare tests for many, many years. And even with that background, it's quite a challenge to become accredited for a new test, especially one that was set up, as you say, in such a short time frame. So really, one of the key things you have to be able to do is demonstrate the overall quality of your service. That's a real end-to-end process, right from the design and development of the service, selection of the partners you work with, right through to all the testing and validation to really prove that the results are robust and accurate.
Fantastic. And how did your work with Haier Biomedical help achieve this?
So they've been a really excellent partner for us in this whole process. We really needed to scale up the laboratory very quickly. In order to do that, we needed a lot of new equipment that we had to not only design along with Haier, but also get the equipment into the building, get it all properly up and running, serviced, validated, qualified. The type of equipment that we were using was very broad, covering safety for our operators, as well as storage and retention of samples. So we really had a big task to undertake. So the relationship between the two companies was really, really important in that busy time.
Fantastic, thank you. It's clear that your collaboration has been valuable for setting up the COVID-19 testing facilities. Now, as I ask your colleague Nick, could you tell us how you have learned from setting up and running a facility such as this within very short timeframes?
So really, like I say, the communication is the key. As Nick implied, things move very fast. They don't always go entirely according to plan. So what's really important is that flexibility and that constant communication with all involved to really make sure that you can reach that end goal as quickly and efficiently as possible.
Thank you very much, Nick and Tom, for that interesting discussion, and thank you to everyone joining us online. It was great to hear your insights into COVID-19 testing facilities. We are now heading back to HBHQ in Qingdao to Enrique Wang, Director UN and Africa Markets, who will provide a broader overview of key corporate social responsibility ideals from higher culture and projects that have saved tens of thousands of lives. Over to you, Enrique.
Hello everyone, this is Eric Wang, the Director of UN Projects as well Africa Sales Department. And here at Haier Biomedical today, I want to provide you with information about how we feel as an organization around our corporate social responsibilities and why we feel it's vitally important as business to continue to innovate in the field of vaccine replication, as it is our duty to ensure that everyone has access to best quality cold chain equipment. And why? As saving lives and improving healthcare networks is priority as well a particular passion of mine. In the past 10 years, and although we have been seeking the expansion of high-end industries and breakthroughs in the high-end technologies, we have never forgotten the actual needs of the emerging economies and the hard-to-reach areas, as well as locations without power supply all over the world. This is especially relevant in the field of immunization. Haier Biomedical's footsteps have spread all across Africa, from the Ethiopian plateau to the desert of Mauritania, from the origin of the Nile to the Cape of the Southern Africa. Haier Biomedical had witnessed that many children are unable to get access to life-saving vaccines. From where we stand, this is not okay. And everyone should be equal, and everyone should have access to vaccines. But it is not the case now, because due to the lacking of infrastructures in these hard-to-reach locations. According to WHO data, more than 2.5 million children die each year from the vaccine-preventable diseases. For us, each step forward in solving this issue is breakthrough for innovation, meaning that more lives will be saved, and also a big step in the advance of cold chain technology. In the past 12 years, through our cooperation with the NGOs, we have delivered tens of thousands of solar direct drive vaccine fridges to more than 30 countries all over the world. Haier Biomedical's cold chain equipment provides a safe, a secure, a reliable, and a stable environment in the hard-to-reach places without power supply. And these solutions guarantee the potency of the vaccines from the manufacturer to last mile of the clinic. And these products and solutions will continue to advance the immunization to the last mile, preventing tens of thousands of children from dying of vaccine-preventable diseases every year. In the last 2 years, the whole world has been enveloped in the haze of COVID-19. But our team have never stopped in the exploration of the needs and the relevance of saving lives. For example, just last month, our team has innovated and delivered a solar laboratory for the Pasteur Institute in Senegal. And this equipment will be used in the screening and preventing of the pandemic in remote areas. This year, Haier Biomedical will also launch a full set of last-mile health solutions under the banner of High Clinic. And through your support, I believe our solution can continue to serve more people in need and make healthcare for all within reach. Thank you for listening, and also staying during the question time, where I will be happy to elaborate further.
Hi, and again, we thank you for your time today and spending this time with us here at Haier Biomedical. For me, the Source customer interview was informative, and it just goes to show you that working with Haier Biomedical can also make you a success story too. My name is George Lee, and I am the director for the Americas. That means I oversee the development, management, and sales for North America and Latin America, a diverse but an amazing region for me and my team to work every day. We know today that some of our key stakeholders are watching, and to you and your teams, we thank you for your commitment and faith in our brand. My job briefly today is to provide you with a better understanding of Haier Biomedical and how we fit into the greater Haier group.
Let me start with a group. Then who's Haier? Haier is the global #1 manufacturer of household appliances as per the Euromonitor for the last 12 years. The household appliances division produces and sells around 20 million refrigerator and freezers units per annum. Globally, we are #1 in this sector. Our strength is in our refrigeration history from 37 years ago. Haier, through its globalization efforts, now has coverage on each continent, with the GE appliances for America, Aqua for Asia, Candy for Europe, and Fisher & Paykel for Oceania. However, it is the Haier management method, 人单合一, which drives and constantly delivers our mission and vision. The 人单合一 model was developed and implemented by Haier's CEO and Chairman, Zhang Ruimi. It is truly revolutionary. One of the core components of the model is the phrase, zero distance to the user. Employees need to face the user, provide value to the user, and keep them at the forefront at all times. Another core component of the model is everyone is an entrepreneur. This gives an extraordinary amount of freedom and control to employees. It democratizes decision-making, going from a traditional pyramid structure to a flat structure. Small micro-enterprises within the group have full autonomy in making decisions, including overall strategy, hiring, and remuneration decisions. I hope this quick overview of the Haier Group gives you a better understanding of the magnitude of the group and how diverse the organization is, and that we truly have full global coverage and reach. What does this mean for you? It means we and Haier Biomedical can ensure you are completely covered, no matter who you are or where you are. Okay, we have covered the group. Then who's Haier Biomedical and what's our competitive advantage? Global top 3 medical cold storage solution provider, we supply the full temperature coverage and full portfolio coverage from conventional refrigerator and freezer, ice line and solar direct-driven vacuum refrigerator, walk-in cool room, and automated storage systems with UL, CE, and PQS global certifications. As the industry leader and IoT pioneer in our industry sector, Haier Biomedical provides solutions for biological sample, medicine, blood, and vaccination management, including your biobank, your reagents, your blood, your vaccination, and recently we are very proud to be the first manufacturer in the world to be certified to the latest NSF 49 2019 standard for biological safety cabinet solutions. A true honor. In ramping up, a key component to our success is that we are an environmentally friendly advocate. We introduced the hydrocarbon reference ULT freezer in early 2014, the first company to offer a full range of energy-saving ULT freezers in the industry with Energy Star certification from the United States. That's a quick snapshot. And as you can see from our exhibition center here in Qingdao, we have multiple solutions to support your healthcare networks. Back to Peter, and I will see you again during the questions segment. Thank you.
Thank you, George, and thank you, Enrique. However, more importantly, thank you to Source Bioscience for your support, not just today, but for your ongoing commitment to working with Haier Biomedical across many markets around the world. And of course, a big thank you to you all for joining us today. For further information from the world's leading manufacturer of IoT biomedical cold chain equipment, and to see all our solutions, from new blood, new vaccine, new biobank, new reagent, and new lab, please go to www.haiermedical.com or join our social media channels to ensure you're up to date every day on the latest solutions from Haier Biomedical. It's now question time, so I'm going to race over and join George and Enrique for your questions. So I'll see you in a moment, and thank you.
Thank you, Peter. Now it's time to begin our Q&A session, where I will be speaking directly with Haier Biomedical to answer your questions. So the first question we have is for you, Richard, based currently in the UK. Please, can you expand on who Haier Biomedical UK are and what your capabilities are?
Yes, good morning, afternoon, and good evening to everyone online, wherever you are in the world. I'll just introduce myself quickly. My name is Richard Giafrato. I'm the General Manager for Haier Biomedical UK. We've been selling the brand into the UK market since 2008. And then in 2016, we were acquired and became a wholly owned subsidiary of Haier Biomedical Qingdao. Since then, we've grown significantly year on year. And we have literally just moved into a new 7,000 square foot facility in Sunbury-on-Thames, just near Heathrow Airport, where we have warehousing and a showroom, which is available and open to anyone who wants to come and have a look at our product anytime. We hold a large amount of stock in the UK, both in our warehouse and with logistics providers around the UK, which enables us to deliver very rapidly to important customers, very much like Source, who are reacting to market trends and needs. In the past 18 months, we've been heavily involved with clients like Source Bioscience, supplying equipment for COVID testing. And we were also heavily involved in supplying vaccine freezers, especially for NHS Scotland, who used our -80 underbench freezer for their initial Pfizer vaccine rollout across the whole of Scotland. And we are now on their framework as a preferred supplier for vaccine fridges moving forward. In terms of the range of products, then they were touched on in the videos that you've just seen. And we hold really good stock in the UK of almost everything that we sell. Obviously, we focus on fast-moving products to service our clients and their needs, but we do try to hold a good, healthy stock of products for everyone's requirements.
Perfect. Thank you, Richard. So we have spoken about equipment purchases, but what about after-sales care of the products?
Yeah, very important to us that. I started my career as a service engineer. So I am very focused on being with the customer throughout the lifespan of the product. We are not a box seller. We want to be with the client and hold their hand throughout the experience of them having with any of our products. We have a team of trained field-based engineers, and where demand is required, we work with trusted partners to provide servicing. This has been a key point over the last 18 months. The demand has been so high, especially with biological safety cabinets, that we have had to outsource some of our work for commissioning and installation and servicing. And I know that Source Bioscience's service has just happened on all of their safety cabinets, and that's critical to keeping them in business and ensuring that they can continue to do what they're doing. And offering that lab service on a 24-hour basis. We hold extensive stock of parts at our facility, and our engineers also have their own stock of common parts that they carry with them at all times. And this ensures that repairs are done in a timely fashion. The most important thing for us is that when something does go wrong, which inevitably things do go wrong, we are there to fix it for the client as quickly as possible and get them back up and running and back to normal. And we offer different types of contracts to suit all requirements, but we also offer excellent warranty terms on all of our range.
Thank you for that answer, Richard. Now Source Bioscience mentioned monitoring. What's the system they are using and what is its functionality?
Well, wireless monitoring is something that we sell, and the wireless monitoring product that we sell has the ability to monitor pretty much anything. Now, within our field of expertise, temperature and humidity are things that people want to monitor all the time. But our product itself will monitor literally anything. So pressure, energy, door openings, you name it, we can do it. And the important thing with our product is that it is IT free. There is no need for it to sit on your network. There is no need to assign an IP address. It really is plug and play. And with the monitoring, this obviously provides assurances to the client that the products are doing what they need them to do. And it will also alert them to any cases where the product is failing or is out of range to their preset requirements. But it also meets any MHRA or HTA or any requirements that the client that needs as well.
Perfect. Thank you for those answers, Richard. Really fantastic hearing from you. So now moving on with Enrique, we could see clearly from your segment earlier how passionate you are about saving lives. How or maybe why did this area attract your attention? And why is this a particular passion of yours? Apologies, I think we may have lost connection with Enrique, so please bear with us while we work to reconnect them to the session. Please do accept our apologies. It's taken a little longer than expected to get reconnected to the session. We hope to have the issue sorted for you in just a few minutes' time.
Hello, Dr. Haslam. You can hear me now?
Hello, yes, we can.
Okay.
Can or cannot?
Okay. Okay, Richard.
All right. Thank you, Dr. Haslam, for your question, and I'm very pleased to answer that question. Actually, Haier has gene of corporate social responsibility. For example, when I joined this company more than 10 years ago, we already donated to more than 250 health schools in China. And also, we just donated the vaccine respirators to more than 30 health facilities in China, which was affected by the flood months ago. And also, all Haier Group members, when we join the organization, we must embrace as well full understanding the culture of this company. And also, we are responsible to pass on this kind of a culture to the new members of the company. And this is one of the key drivers to me as well as my colleagues in the primary healthcare industry. And also, I have a very lovely daughter, and that makes the drivers more than passionate and also a kind of a responsibility. Thank you.
Thank you, Enrique. And as a follow-up, what are yours and the greater Haier Biomedical team's next steps to improve healthcare networks even further in remote, hard-to-reach, and areas that have none or irregular power supply?
All right, this is also a very good question because this is a question to lead us to a broader view of the market. We have proved ourselves very successful in the vaccine cold chain for the last 10 years, and we already supplied more than 100,000 of vaccine fridges to more than 100,000 health facilities all over the world. However, this is far not enough. Since 2022, we are also ready to further deploy our solutions from the vaccine cold chain to the last mile healthcare. And this will be divided into several directions, such as vaccine cold chain logistics, blood collection, solar clinics, and solar lights. And we really hope these solutions can promote and help and support the healthcare situations in the very hard-to-reach areas. And also, we hope we can collaborate with our partners. And also, we are also ready to get more communications with anyone who wants to have further discussion with us. Thank you.
Perfect. Thank you, Enrique. Now, Mr. Lee, earlier in the webinar, we heard you speak about some background information on the greater Haier Group and how Haier Biomedical fits within the group. The question I have for you today is, how does being part of the group create value for the distributor, customer, or end user? And how do they benefit from Haier Biomedical being part of the group?
Thank you, Dr. Haslab. Derived from a group R&D center around 20 years ago, Haier Biomedical fully integrates and shares the technology through the group platform. Besides our own continuous investments on R&D and innovation, this enables us always in line with world latest technology to provide the most advanced products and solutions to our customers. Meanwhile, with the dedicated support from the group company, Haier Biomedical has been the pioneer to transform from a traditional medical fridge and freezer manufacturer to be the industry-leading IoT solution provider. Thank you.
Perfect. Thank you, Mr. Lee. Thanks for sharing that overview of the Haier Group company and Haier Biomedical. I believe most of our audience now have a clearer picture. I know you have a lot of reference customers globally. Can you tell me what's the main factors for them to choose Haier Biomedical under such a competitive and mature market? And as a follow-up, can you tell us a little more about the distributor, how a distributor can become part of your network and be part of the Haier Biomedical team?
Okay, yes, you're right. There are more and more reference customers, choose Haier Biomedical to be part of their lab solutions. Just this Tuesday, U.S. local time, we delivered the first Haier Biomedical ULT freezer to CDC Atlanta, so which we won from an international public bidding with a 5 years supply agreement. So basically, we offer a good product line which provides excellent performance while with excellent reliability, which has been recognized from many countries. Meanwhile, we have the flexibility and capability to listen to the customer needs to provide tailor-made products or solutions. Plus, the good coordination and cooperation with our local distributors, we should offer a quick delivery and professional service, which is quite important for most of the customers, especially during the pandemic period. Back to our question of how to be a kind of Haier distributor. Basically, a co-creation and sharing is part of our business philosophy, which means we are open to work with those potential distributors who know the industry very well, and more important, they are willing to focus on Haier. Because at the end of the day, we are in the same boat. So most of the time, we work closely with our distributor to better serve end user. I always believe a good customer experience will benefit both our distributors and our company. Thank you.
Perfect. Thank you for that excellent answer, Mr. Lee. Now, Peter, as the International Marketing Director, I have a couple of questions for you. So, over the last 18 months, what are the main challenges that Haier Biomedical team encountered at home and abroad? And how has Haier Biomedical overcome these challenges?
I think we are like most companies around the world that we've all had challenges during the pandemic, and we will continue to have challenges moving forward. So we're all in the same boat when it comes to that kind of what's happened in the last 2 years. But like everybody else, we've had to realign how we do business, and that means doing business from a different perspective, which means we can't travel, we can't go overseas, we can't see our customers face to face. So we've had to redo things a different way, and that's by creating different channels and different ways of meeting our customers online, using different platforms and different apps to make that happen. So like everybody else, we've done that, and we've achieved magnificent goals. In 2021, during the pandemic, we actually grew 100% in our business, as did a lot of our competitors around the world in this particular field because of the pandemic. But in saying that, it was done through a lot of hard work by the teams, and I've got two gentlemen either side of me, and their teams worked very hard, and other teams in Europe and Middle East and Asia as well worked very hard during that time to continue to support our overseas distributors, our overseas teams, and our overseas partners that were delivering on behalf of us because we could not be in the market. But in saying that, the team from right across the Haier Biomedical has done a great job, and by working as a team, working with our key stakeholders, working with our partners around the world, we've been able to achieve our goals. And together, right through 2021 and into 2022, we'll continue to do the same. It's teamwork, as both Mr. Lee and Enrique said either side of me. Without teams and without unity, we will not succeed, and we've been able to do that because of the great relationships that our members have made around the world. So it's all about building relationships, and keeping those relationships is why we've been able to overcome the impediments of the pandemic.
Perfect. Thank you, Peter. And what support do you provide to your key partners, distributors, and stakeholders in the form of marketing materials?
Well, as we work with many diverse markets, countries, continents around the world, so we are across more than 160 countries. So each individual market has its own perspective on what its needs are. So we try to work with our stakeholders, partners, and different governments in each of these different markets to provide them with the materials or the tools to ensure that they're driving our brand, which is, again, as Mr. Lee said in his part, that it's a win-win situation. So if we're providing those tools to improve their business, which in turn improves our business. So from our point of view, our stakeholders are our partners, they're part of our family, the greater Haier Group family, and by providing the marketing tools, whether that's helping them with their websites or providing information through through brochures, flyers or videos, or working with our distributors to do online training, or by providing other tools to do with our products and services. This is how we try to do the best we can to ensure that we deliver what we promise to our distributors so that they can obviously build their business at the same time grow our business. So it's a win-win for both organisations.
Thank you for sharing that overview with us. Peter, you are also the Director of International Business Operations. As Haier Biomedical moves forward into 2022, what is Haier Biomedical's post-pandemic engagement strategy?
Well, I think a lot of companies have had to change the way they do business, as I mentioned earlier, over the last 18 months. So everybody's looking at what's going to happen at the next stage as we move into 2022. So from our company's point of view, we are expanding globally and into different markets such as the US. And Mr. Lee and his team are driving a different strategy next year. So we are localizing more into that market. Enrique, sitting the other side of me tonight, is also with his team pushing harder into their markets, working closer with the UN and other NGOs. And also the UK is doing more work into how we do business into Europe
and the company is now looking at further localization into key markets across Europe, including Germany, France, Spain. We're already based in Italy, so we are really making sure that we are now investing in key markets around the world. We have the leading products, we have the leading solutions, we have the best people, so it's now time that we actually take the next step and we'll be pushing further into key markets around the world. So our post-pandemic strategy is localization and making sure that we are providing the best services from Qingdao in China and in our localized economies around the world. So this is our part of our moving forward into 2022.
Thank you for sharing that with us, Peter. So we now have some questions for Source Biomedical. So the first question we've got is, where do you see the demand for COVID-19 testing coming from now?
Hi, good afternoon, Carrie. Can you hear me all right?
I can, yep.
Hi. So the demand is still there from a certain extent for testing for day 2 and day 8 and test to release travel. Tests for travelling, I think, will continue for a period of time for both fit to fly and UK entry testing. And there's another area that's quite lucrative at the moment, which is large organisations or corporations offering in-house testing to their employees and also for their business travel needs.
That's perfect, thank you. So how did setting up a COVID-19 testing service impact your existing service offerings?
So Source Bioscience were already quite well positioned to set up a COVID-19 testing service. We already had a facility in Nottingham performing histopathology and genomics analysis for the healthcare sector. This was obviously hit quite hard during the pandemic, so we took the decision to realign our services to help support the national effort to contain the pandemic through testing, and already having a lot of the knowledge and expertise through our genomics business really allowed us to set up quickly to offer not only testing to support Lighthouse Labs, but also as international travel turned towards COVID-19 testing, we could very quickly offer day 2 and day 8 testing, including those really crucial genomic services, such as the whole genome sequencing to identify variants of interest, which has formed such a crucial part of the government approach to monitoring new variants that are up and coming.
Fantastic, thank you. So we do have another question that's come through, which you are free to answer, Source. So what advice would you have for someone setting up a COVID-19 testing facility?
So I would say that it's certainly not an undertaking to take lightly. It takes a lot of technical knowledge and experience, a lot of planning. The UK government and regulatory authorities have now put in place a lot of safeguards to make sure that any service providers or laboratories wanting to enter the market set up robust and accurate tests that are supported by a high quality management system. And there's almost as much work to do on that side as there is on the technical detail of setting up a service itself. So it's really a long road, and one that you have to consider seriously before setting off on.
Really great answer there, thank you. So we've got another question for you, which is, what was the single biggest challenge Haier Biomedical helped you overcome?
So I would say on that side of things, really, we already had a relationship with Haier, which proved to be very useful. I'd heard reference to temperature monitoring and things. So we were already in contact with them. That made them a very attractive supplier for us for other equipment that we needed in the laboratory. So our experience of them, working with them, was already very good, and that made it easy to implement some of their other tools in our service, such as their controlled temperature storage and other equipment for ensuring the safety of our staff and of our samples.
Thank you, Source Bioscience, for sharing those insights with us. So we have a question now directed to Haier Biomedical, and this one is, how do you deal with the different regulations and requirements around the world?
That's a very good question. I think, Enrique, would you like to take that one? Just clarifying, can you please say that again, Dr. Hazel?
Yeah, of course. So this question is, how do you deal with the different regulations and requirements around the world?
It's a very good question. Because we have our partners and our distributors in each country, we trust those partners to deliver us the information they require to ensure that we meet local authority rules and regulations and policies. So having that network across the world of a tight, hard-working team that Haier Biomedical works with, whether it's in the Americas, Europe, Africa, or within the UN group, it's about understanding what's happening in those particular countries or those particular markets. And because of our strong relationships with our key stakeholders, we get an early understanding of their policy requirements of those governments or the requirements of that particular sector. So having that close relationship with our partners ensures that we have a full understanding of what's needed in different economies or different countries. So this is how we best overcome those impediments, is by having that close relationship, or what we call as guanxi, with those particular customers of ours and end users.
Thank you, Peter. Great answer. So we've got another question for you, which is, where can I find out more information about the support Haier Biomedical offer?
Well, you can either come directly to our website, which is www.haiermedical.com, or you can see, you heard from today from Mr. Lee and Enrique Wong. You can find us by going to that website and going to the team. You can click on individual people. You've heard from Richard today in the UK, but if you look at our website, if you go to the team or About Us, and then click on About Us, go down to the team, you then choose the individual markets of people that you would like to talk to. You click on that, you'll be able to send an email directly to that individual, depending on which market you're interested in, or you can look into the website, find which products you're interested in, and then make a direct contact as well. Our inquiry email address is at the bottom of the website, including our phone number. So there's a few avenues that are quite easily available to people that are interested in talking to members of the Haier Biomedical team, and it doesn't matter which area, region or country, you can find that person through that particular part of the website.
Perfect. Thank you, Peter. So we've got another question, and this one is, how do you deal with the unique challenges when you're dealing with different regulations worldwide?
Well, I think that's a little bit similar to the earlier question, but obviously there are similar regulations around the world when it comes to environmentally regulated products, different energy standards. So obviously the Americas is very different to Europe, but they still want the same kind of energy efficiency and green standards, and to be environmentally friendly. So our products are tailored, and we are the leading on hydro with our different products have been manufactured over the last couple of years to ensure that we're meeting the standards of being a green company. We are the leader in this particular area, this particular technology, and our hydrocarbon is actually the leader in the world, and we continue to invest and innovate in new technology to ensure that we continue to stay the leader, to ensure that we are covering all elements and needs from different countries and different policies that are provided from different governments.
Perfect. Thank you, Peter. And thank you very much to Haier Biomedical and Source Bioscience for that interesting discussion. And thank you to everyone joining us online. It was great to hear your insights into COVID-19 testing facilities. If we didn't have time to answer your questions, we will follow up with these after today's event. If you do have any other questions, please feel free to submit them now using the Submit a Questions tab to the left of your screen, or email me at editor@selectscience.net and I will follow up with your questions. You can also download related documents in the Related Resources tab to the left of your screen, including a certificate of attendance. If you would like to listen again to today's webinar or invite a friend to listen, it will be available to watch on demand in just a few days' time. Goodbye, and thank you once again for joining us.
Okay.